We start by examining the FDP function. The FDP is the only tendon that flexes the distal interphalangeal joint. This can be tested either individually by asking the patient to flex the DIPJ, or all together by asking the patient to form a fist and looking at flexion of the distal interphalangeal joint. Testing the FDS is more difficult because the PIPJ is flexed by both the FDP as well as FDS. This can be tested by blocking the FDP of two fingers by preventing DIP flexion and asking the subject to flex the PIPJ. This is a pure FDS function. You can see the DIP is lax. This is the standard test. However, this test doesn't work for the index finger because this has a separate FDP muscle and it cannot be blocked despite blocking the DIP of these three fingers. We can do the isolated DIP extension test for individual fingers. This is done by asking the patient to pinch. So as you can see here, the FDP is deactivated and this indicates pure FDS function. We can do this in sequence for each of the fingers. Excellent. In subjects that lack an FDS to the small finger, the individual test does not work as seen here. He is unable to bring this position because he lacks an FDS to this finger. This can be seen here, and you see he is unable to flex the FDS. Only when the ring finger is left is he able to flex it. We can also do a combined DIP extension test, which is done by this. And here you can see the FDS of these three fingers is intact, but this finger lacks the FDS. Again, here all the fingers have an FDS because the patient is able to flex the PIP while keeping the DIP extended. Thank you.